I'm Dr. Streicher. Your question is, what happens to skin in menopause? I'm going to give you the inside information. Clearly something happens to skin in the mid-50s, and that something isn't good. So here's the question. Is it just a coincidence that wrinkles and sags occur the same time that your periods disappear? Or is it just one of those midlife things? Well, the answer is both. Years of sun, smoking, pollution, sleep deprivation, and poor diet definitely take a toll. Genetics makes a huge difference. And okay, I'm just going to take a moment and thank my mom who had beautiful skin. Thanks, Mom. But all of that aside, menopause, it's not good for your skin. And you're not crazy if you're convinced that at the same time you started having all day, all night hot flashes and vaginal dryness is the same time your face started moving south. The reason skin changes occur at the time of menopause is because skin is loaded with estrogen receptors, which means that the plunge in estrogen that occurs at the onset of menopause is going to have a significant impact. So specifically, this is what happens. That lack of estrogen causes extra lines and wrinkles because there's actually a 30% decline in collagen in the first 5 years after menopause, and it keeps going. You continue to lose an additional 2% of collagen every year after that. There's also a decrease in elastin. Elastin is a protein that's responsible for keeping your skin nice and taut, the difference between a brand new rubber band instead of an old stretched out rubber band. Less estrogen also means a disruption in melanin production. Now, melanin is responsible for skin pigmentation, which is why menopausal skin tends to be blotchy and those lovely age spots that appear. Estrogen is also necessary for good blood flow to the skin and honestly almost every other organ in your body, as you know from my other videos. But you combine that poor blood flow with the decrease in collagen, and that's why skin becomes thinner, drier, and more vulnerable to bruising. In addition, that decrease in blood flow means your skin isn't going to heal as well. And that's why your skin is so much more fragile and heals really slowly. There's more. The reason older faces tend to look more hollow is that there's an estrogen-dependent loss of fat tissue. Now, I'm actually convinced the fat is not lost, it just travels straight down to the hips, but it does leave your face and it does change the contour of your face. And your hips and spine are not the only place you lose bone. It also turns out you can lose facial bone mass, which makes your eyelids sag a little more and those jowls appear. Okay, so all is not lost. There are actually things you can do. There are action steps you can take. They're going to make a real difference. So check out my other videos on menopause and skin, and you'll also find lots more information on drstreicher.com.